Welcome to Wednesday's edition of COVID-19. There's been a rebound in cases today, and our daily tally has surged past 600. Now, this uptick comes amid continued interest in Korea's COVID-19 strategy, which we are poised to explore later on in the program. Here first are the pandemic updates with our Kwon So-ah. Now, so let's start here in Korea with the jump in cases.
Yes, Sunny, it's a jump by more than 200 infections from yesterday, raising the total number of infections to 677 this Wednesday. And the number of domestic transmissions has risen to the mid-600s. So the drop to the 400s we saw in the past days was not a sign of relief as of yet. But if you compare the figure from the Wednesdays in the past week, there's actually not a big change, as the numbers have been in the 600 to the 700 range. And if we go over to our map now, we have quite a surge in the capital, Seoul, with 258 infections. That's 111 more than yesterday, and also almost 200 in Gyeonggi-do province and many other places across the country with double-digit figures of new infections. And with that, Korea now has an accumulated number of 141,476 infections, with a death toll at 1,965.
Right. Now, so one number, though, that we would like to see go up is that related to vaccinations, right?
Of course, Sunny. So let's take a look at the vaccination updates now. We've got over 565,000 people who got their first shot yesterday, and also almost 26,000 who received their second shot. So with that, 12.4% of the nation's population has at least received one jab. And now there's also been interest in early booking for vaccination, including for 1 million military-affiliated people who could book for some 900,000 jabs on Tuesday, while reservations for senior citizens vaccination will continue until Thursday. Here's what Prime Minister Kim Boo-kyum had to say on the vaccination drive earlier at a briefing this morning.
The vaccine reservation rate for seniors aged 60 and above has neared 75%. Appointments for Janssen vaccines from the U.S. have been fully booked in just a day. This is all thanks to the cooperation of the nation's people who understand the importance of vaccinations.
With the government also pushing for complete inoculation of teachers and senior high school students by the summer break in July, the Education Ministry announced its plan to expand in-person classes. So the ultimate plan is to get all students back to classrooms in the second semester in fall, regardless of social distancing measures, on the back of concerns that continuous mix of online and offline classes can lead to education gaps. Before that, the cap of 1/3 in the capital region that's under level 2 social distancing measures will be relaxed to 2/3, with more middle school students to attend in-person classes beginning in the middle of this month, and vocational schools will be entirely exempt from the rules. And now, shifting our focus abroad, Israel, on Tuesday local time, has lifted almost all of its COVID-19 restrictions, including an abolishment of its Green Pass system or its vaccination verification system. And more than 80% of adults there have now been fully vaccinated. A place with over half of its population now vaccinated with at least one dose, the U.S. has been seeing a downward trend in new COVID-19 cases in the past week. According to Johns Hopkins University data, the 7-day average of daily infections dropped to below 20,000 as of Monday local time. And that's also similar to what we saw as of noon Korea time, as the U.S. with around 23,000 new infections now stands at 34.1 million. India at 28.3 million has reported over 130,000 infections. And there has also been a surge in Brazil here at 16.6 million, with over 70,000 new cases in a day. And the total number of infections around the world stands at 171.9 million, with over 468,000 new cases. And those are the updates I have for now. Back to you, Sunny.
All right, So, thank you for that. Right, now for more on the local vaccination campaign, which has been picking up pace, I have our Abby Lee here in the studio with me. Welcome, Abby.
Hi, Sunny. So Korea has been picking up its vaccination efforts, as you have mentioned. So far this week, 12.4% of the country's total population received at least one dose. That's about 5.5 million people. Around 75% of those over the age of 60 have also booked their vaccine appointments. During Tuesday's regular briefing, the Korea Disease Control and Prevention Agency addressed concerns regarding the side effects of AstraZeneca and Pfizer vaccines in particular. Let's take a listen to the KDCA commissioner.
For both AstraZeneca and Pfizer, the number of reported side effects is higher among young people compared to the elderly. When looking at the number of post-inoculation deaths, there have been similar occurrences in the UK and other countries abroad, while no meaningful differences between the two vaccines have been observed.
So you may be wondering what this is in reference to. The remark follows the first case of a vaccine-induced low blood platelet count. A man in his 30s who had a pre-existing condition of cerebral hemorrhage and other health issues was hospitalized earlier this month. He received treatment after suffering a convulsion that was not life-threatening.
Right, and keeping this case in mind, what does the government plan to do to ease public concerns?
The KDCA head said the agency plans to compensate for this man for the damages in a prompt manner. She emphasized that low blood platelet count is a treatable condition when detected early and with proper care. She urged the public to seek medical advice when experiencing a severe headache or persistent stomachache within 4 to 28 days of inoculation. Chung also reminded medical institutions to double-check patients' medication history when they show symptoms and to treat them accordingly to the national guidelines.
Now, staying with post-inoculation concerns, Abby, there are reports over in the US of men in their 30s suffering from inflammation in their heart muscles after vaccination. What is the KDCA's response to this?
So they got a lot of flack because of this, but in the US and Israel, there have been reports of the myocarditis from the younger male demographic after receiving Pfizer or Moderna vaccines. Research on the possible link between the vaccinations and the health condition is still ongoing and yet to be confirmed.
Right. Now, before you go, Abby, I understand there is growing speculation over the origin of the coronavirus. Could you touch upon that, please?
Sure. So due to the lack of information on the first few known cases that are stemming from the Wuhan, China, among other roadblocks, scientists are urging for more data from Beijing. A group of leading scientists around the world said the theory that it was caused by a laboratory leak needs to be taken seriously until there is a rigorous data-led investigation that proves it wrong. Stanford University's David Relman, who co-authored a letter in Science magazine for a look into the possibilities, said the demand for thorough research doesn't equate to taking a shot at the Chinese government.
When we talk about the possibility of a lab accident, we are not necessarily talking about anything deliberate. We're not necessarily talking about the engineering of a new virus. This could be as simple as a laboratory seeking to grow viruses from important samples, bat samples, not realizing that one of them contained SARS-CoV-2.
Experts say understanding how and where the virus originated is crucial to preventing another pandemic. The COVID-19 outbreak has taken more than 3.5 million lives around the world. That's all for me today.
All right, Abby, as always, thank you very much for the coverage.
Thanks for having me.
Right, elsewhere around the world, authorities in Japan have extended a state of emergency in Tokyo and other areas by about 3 weeks to June 20th, while organizers of the Tokyo Olympics are looking to launch the event in about 7 weeks. For more on the situation there, I have Yoichiro Teiwa live on the line. Welcome, Yoichiro.
Hi, Sunny. Nice to be here.
Right. Now let's begin then with the COVID-19 situation in Japan. What has the daily tally been like in recent days?
Well, it shows some good sign, the dropping. If you compare with Korea, that's still devastating. But it's roughly about like a 2,000 and something now infection a day. So it's getting better, but still, as you said, that's a state of emergency. So a lot of businesses is not locked down, but still not opening. That's the situation right now.
Yoichiro, I understand variants have been fueling the latest wave in Japan. What more can you tell us about this?
Well, I mean, the Could you say it again, please?
The variants, I understand, are fueling the recent.
Right now, we have variants, it's supposed to be coming from Britain, but so far we have found some infected case with India. So about the variants, we have probably the government as well as the prefectural government, they underestimated. So we start from the beginning of this year, but they didn't do anything. So it all spread. So that was the cause of this, they call it forced pandemic, but I don't know what the number is. But so far, as you say, that's a 4,000 a day was about to be the average within a couple of days. But so that was the situation from the variant.
Right, but the daily tally has been declining now. Yoichiro, with regard to the Tokyo Olympics, I believe there have been mounting calls for its cancellation from the public to the organizers. Is this debate still on?
It is, but as you know, the Prime Minister at the same, at the Parliament session, he was repeatedly saying that he would do the safe and, the best Olympic that they could do. So far, debate still going on, but we don't know yet what will happen.
I see. What appears to be keeping the government from cancelling this event, do you think, Yoichiro, in your opinion?
Well, it's obvious. It's kind of like a chicken game. If IOC decided to cancel the game, that's fine. But as far as the Japanese government would want to start discussing about a cancellation, they have to be the one who has to compensate the damages the IOC would have. So the government doesn't really have any choice. I mean, they just, nobody, the problem is nobody wants to take any responsibility. So they just keep things going and not mentioning anything.
Meanwhile, Yoichiro, what has been the response, the local response there in Japan, with regard to the recent U.S. advisory against travel to Japan?
Well, as the U.S. government, as well as Japanese government, have stated that would not make any difference as far as the Olympic Games is concerned. Well, the thing is, the Japanese government start the idea of, the scale down of the Olympic Games. So it used to be like 180,000 people were supposed to be coming into Japan, Tokyo, but the government urging the people to scale down the numbers. So they say right now 78,000 people, and they are urging more to drop the number of people who are coming. And also, they're saying that it's not going to be any contact with the people with Japan. Sounds like a very unique Olympic game, even if they hold this. There's no friendship, there's no events related to the people with the athletes. But so far, they just keep on saying that it's going to be Olympic and with no contact with the Japanese public, and they call it bubble system. I didn't know what the bubble is. They say they just came here. They stay in a hotel village of the athletes, but they just go to the stadium back and forth. And then when this thing's over, they just go back. So that's the idea of the Tokyo Olympic. I don't know if you call this Olympic, but that's what it is right now.
I see. And what other measures, Yoichiro, have been disclosed thus far with regard to COVID-19 prevention efforts during the Olympics, which are poised to start on the 23rd of July, right?
Right. So it's almost like the 1 month and more. And the other measure, they said that was the vaccination to all these Olympic athletes and those who are coming. But the problem is, as you can see, the vaccination in entire Japan is very limited. It's a very small number of people have actually had a vaccination. So there's another issue that they do that for Olympic Games, but they don't do that for the people of Japan. So that's another the anxiety that the people here have.
Yoshimura, what appears to be holding up the vaccination process for the public then?
The system. I would say the system is not really working well. The vaccination history in Japan is I could say the failure. A lot of people have been damaged by the vaccination. So it is true that the Japanese public are not really welcoming this vaccination. So as a government, they're not really, well, as I said, that the Japanese government actually underestimated the situation. They didn't know what would happen. So they were not really enthusiastic about, the sorting out system of the vaccination. So now they are panicking in a way, and they're trying to sorting out system. So that is the result of this slow vaccination in this country.
Right. Hopefully things will look better in the near future. All right, Yoshimura, thank you very much for the latest from Japan.
Welcome. Thanks, Fan.
Right, back on the local front, public interest in no-show vaccines, better known as surplus vaccines, has been mounting in recent days. And in this next report, we explore this interest and the method of making most of the opportunity to get an early vaccination. Do take a look.
The South Korean health authorities said starting from May 5th, those who are fully vaccinated against COVID-19 would be exempted from the mandatory 2-week self-quarantine. And because of that, the demand for a surplus vaccine is soaring across the country.
South Korea resumed wider use of AstraZeneca's vaccine on May 27th. On the same day alone, some 60,000 people reserved for surplus vaccines, and a total of over 150,000 people have received surplus shots last week since the vaccination program restarted. All of these are possible because opened vaccines can be stored in the refrigerator only for a short amount of time. For example, one AstraZeneca vaccine bottle contains 10 to 12 doses. However, if they are not used within up to 6 hours after opening, the remaining doses should be discarded.
오늘 코로나 접종 노쇼 하시는 분들이 한 4분 정도 계셔서 전화를 드리려고 합니다. 저 다름이 아니라 저희 병원 노쇼 백신 관련해서 연락드렸는데 혹시 다른 병원에 접종하셨을까요? 혹시 그럼 오늘 내용 가능하세요?
This person made the reservation in advance to get the surplus vaccine and visited the hospital within 2 hours of receiving the phone call.
이거 잡아주세요. 네. 팔에 힘 푸시고 나가네요.
이미 한 달 전에 신청을 했는데 없겠구나, 지금 당연히 없겠구나 생각하고 때 되면 맞으려니 그렇게 생각하고 있었는데 전화가 오니까는 일단은 생각보다 빨리 혜택을 받는 것 같아서 감사하게 생각하고 왔습니다. 집에 어른도 계시고 애들도 둘이가 있고 한데 저 아내 같은 경우는 병원에서 근무를 하는데 먼저 맞았거든요. 애들 걱정이고 집에 어른 걱정이고 그런 거지, 밖에 사람도 만나고 하니까 그런 게 없는 데서 빨리 맞으면 좋겠다는 생각을 하는 거죠.
So what about others?
왼발 골절 때문에 수술을 하게 됐어요. 그래서 그 시기를 놓쳐서 이따가 수술 후에 퇴원하고 주치의한테 물어보니 백신을 맞아도 된다라고 해서 빨리 맞게 됐죠. 남들한테 피해를 덜 끼치겠다라는 점에서 저는 아주 긍정적으로 생각을 해요.
부모님이랑 같이 생활하고 있는데요. 부모님이 이번에 신청 대상이 돼가지고 부모님이랑 같이 저도 맞으면은 아무래도 더 좋을 것 같아가지고 맞게 됐습니다.
So now you might wonder how to get a surplus vaccine. And to answer the question, I will show you how to make a reservation.
To make a reservation, you first need to access COVID-19 vaccine reservation system online. Then you can search for nearby medical facilities where surplus vaccines are available via Finding Medical Facility page. Once you find one, just simply make a phone call and you are good to go.
제가 노쇼 백신 맞고 싶은데 혹시 예약 가능할까요?
Starting from the 27th last month, it has become much easier and convenient to make a reservation. Anyone can check the number of available surplus vaccines and make same-day bookings under Naver and Kakao. Type in the keyword surplus vaccine shows the number of available doses at each medical facility. After self-authentication, you will be able to use the same-day booking service. If there is no available dose, you can use notification alerts. Once it is available, the hospital will let you know. Those who have already been vaccinated, those who pre-booked for vaccination, and those who are under the age of 30 who is not recommended for the AstraZeneca vaccine cannot make a reservation.
For those who got the surplus vaccine, the second dose will be administered at the same medical facility 11 weeks after the first. So make sure you mark your calendar and don't miss the date. This has been 신세벽.
미국의 블룸버그 통신은 이번 달에 코로나19 회복력 수비를 발표하면서 한국이 보여주었듯이 국민들이 정부에 대한 믿음을 가지고 있으면 봉쇄가 필요가 없다 이렇게 평가해 주었습니다.
In today's studio session, we take a moment to look back and to acknowledge the dedication of relevant authorities in the ongoing fight against the pandemic. For more on this, I have Dr. David Kwok from Soonchang University Hospital. Welcome back, Dr. Kwok.
Thanks for having me.
And I also have Sébastien Felati from French daily Le Figaro. Good to see you again, Sébastien.
Good to see you again.
Right then, Dr. Kwok, the U.S. Food and Drug Administration recently published a review of Korea's COVID-19 response strategy, claiming that our experience may be informative for future considerations. As a medical professional yourself, what do you believe is the significance of this assessment?
Well, it's a huge compliment that we've done very well during the first phase of the pandemic. It's a report from FDA under the Department of Devices and Radiology. They study very thoroughly what we had done in the beginning phase of the pandemic, as in the vigorous tracing and quick to action allowance of tests to be developed by the private sector, and also the government's decision to back up financially once they are developed by the private sector. They are basically saying in the report that those are some of the things that they some parts of the U.S. should learn from. That also they went on to study how we came to actually be so good in the process. And I do take that as a compliment that we have done so well. But I guess also for a perspective of looking back on ourselves, we probably should continue to do so in the latter half of the pandemic. So we should probably come up with some ideas to continue to do the K constellation or K vaccines and whatnot.
Right. And staying with that, Sébastien, Korea stood 5th in Bloomberg's monthly COVID resilience ranking back in May, amid acknowledgement of the country's tackling of the pandemic. Now, I understand you recently wrote an article also acknowledging that is our containment efforts. Do tell us a bit about your coverage.
Well, I think it's interesting to look at the bigger picture of the region. Of course, South Korea has done a very impressive job, like most countries in East Asia, through this pandemic. We see the level of casualties extremely low compared to what you see in other parts of the world, especially in Europe, in US. We are talking here sometimes 1 to 100, so it's spectacular. What's interesting is actually most of the countries in East Asia, we think about Vietnam, Taiwan, Singapore, they went for what we call a zero COVID policy. I would say South Korea actually went for an almost zero COVID policy, which is like the number of casualty is a little bit higher than places like Vietnam, Taiwan, for example, where it's only like a handful of dead people over a year, which is extraordinary. But South Korea today is a bit higher, but of course, those countries who have been extremely radical in their approach today are facing a resurgence because they are starting from so low that suddenly there's a pickup and it's very visible. Korea has not been as low because they're a little bit more flexible. No quarantine in the hotel, quarantine at home. There's a little bit more. I think Korea has a more pragmatic approach, which can turn out as a blessing today because it means when we are moving to the next phase, we're going to have to reopen up, we're going to have to vaccinate it, and maybe there's a bit more tolerance to reopening the country and supporting the economy, because that's the big question. I think Korea has been pragmatic at not to put the country to lockdown to protect the economy. So I think Korea in the East Asia region has quite a particular approach and slightly more pragmatic than other countries here.
Right, and staying with the pat on the back for Korea's response to the pandemic, I have Thomas Yoshimura at the Konrad Adenauer Stiftung, a German political foundation, joining us live on the line. Welcome to the program, Mr. Yoshimura.
Thank you very much for having me.
Now, I believe you wrote a report on Korea's digital contact tracing system earlier this year. Could you start by telling us a bit about your report?
Yes, thank you. Actually, we realized with the numbers as they were in Germany and Europe, it would be very much important and clearer important to look beyond Europe for comparison, look where it's done, how it's done in other places, how it's done better in other places, and look also beyond the United States or the People's Republic of China and how they were doing it there. And the case of South Korea, as much as the case of Taiwan that we looked at, was interesting because there was a pragmatic use of data and technology in a democracy under the rule of law. There was a combination of digital infrastructure capacities. There was a legal framework. There was transparency and trust also, and a very different attitude among the population that caught our attention, and that is focused on in the report.
Right, and staying with the pandemic, Mr. Yoshimura, before we go any further, what is the COVID-19 situation back in your home Germany at the moment?
Thank you for asking. The numbers are going down, luckily, and vaccination is rapidly developing. We're about 40% now having received a first shot, I believe. Therefore, some of the measures are about to be lifted. We have experienced some lockdowns. People are now getting back some of those freedoms that they were missing, which is different from Korea, where those freedoms had not been taken during the time. So the mood is different. We're looking forward. And we're now challenged by deciding how to phase back into something that could be a new normal, be it in schools, be it in workplaces, events, be it for international travel. And we have to decide on how and when to do that. And at the same time, be reminded that the pandemic is not yet over. We still have, I believe, around 4,900 people being newly infected within the last 24 hours, and 179, I believe, have died.
I see. But hopefully the numbers will go down in the near future. Now, Mr. Yoshimura, you've been observing firsthand Korea's handling of the COVID-19 outbreak here on the local front. Are there any aspects of Korea's strategy that you would like to highlight further?
Besides the technology use, it was that people took it seriously from the beginning. There was little of discussion that they're really facing an epidemic situation and then a pandemic situation. There were masks and people were ready to use it. And then there was legislation in place to make things possible. There was testing in the beginning, which was astonishing for other countries how South Korea managed that. There was a clear-cut quarantine regulation that I experienced myself that might be hard to implement in Germany or in the middle of Europe, of course. But for example, what also was very interesting was the QR code system you needed for entering restaurants, cafes. That kind of solution was discussed in Germany and Europe, but then there was another sense of balance between the protection and the use of data.
Right, I see. All right, Mr. Yoshimura, thank you very much for your kind words.
Thank you.
Right. Sebastian, going back to what Mr. Yoshimura just said, there has been dispute over privacy concerns with regard to digital contact tracing amid the pandemic, of course. Where does the debate stand right now?
Well, you're right. There's been a lot of resistance, especially last year, about this issue. First, because there was no legal framework in Europe, unlike South Korea, which has experienced MERS. So there was no legal framework, and people were resistant to the idea of providing data to the government or providing data to an unknown entity. So there's been resistance, but interestingly, things are shifting now because we're in a new phase, especially in Europe with the vaccination. People are seeing things in a different way. I think it's like, people are looking at freedom and they see vaccine as a way to get freedom back. And to do this, now in France, but also in the EU, they are passing legislation that allow, for example, a so-called health certificate, digital health certificate, where you're going to be able to scan like we do in Seoul, like when you want to enter some venue, some restaurant, and also to cross borders, because the EU is 27 countries. People are used to travel across borders, and they want to do this again this summer before the vacation. So this EU digital pass is going to be implemented from July 1st, and this is actually based on an idea that you have to give some of your data about your vaccination status, about your PCR code, PCR test, and that's going to help you to get your life back. So it's interesting to see there is a shift. There's still some resistance, but clearly people are becoming pragmatic, and there is some acceptance because people see the benefit in their real life, I think. So there is a shift now.
Right, so there is some advancements there.
Yeah.
Dr. Kwak, if I were to ask you to highlight one difference in strategy between Korea and its neighbors against the pandemic, what would you care to share?
I think the biggest difference that we would see from others is the mandatory isolation for confirmed people to stay at a social facility rather than to stay at home to be observed for their symptoms and whatnot. Through this way, we were able to isolate and have them not spread to others, almost eliminating any chances for them to actually transfer to others their infections for a certain period of time. And also this way, we were able to actually reduce the mortality and severity rate because medical personnel who are appointed at the social facilities were able to observe people and their progress into the disease. So I think that's one advantage over the other countries that we used to have.
I see. Meanwhile, over in the US, authorities are witnessing declines in their tallies. And for more on the situation there, I have Dr. Georges Benjamin, the Executive Director of the American Public Health Association. Pleasure to have you with us, Dr. Benjamin.
Thank you for having me.
Now, Dr. Benjamin, do tell us a bit about the situation in the US. Do you believe the country's inoculation drive is triggering a decline in the daily tally?
Oh, there's no question that it has. As you know, like most nations, we really did not have a lot of adequate amount of vaccine early on. But now that we've scaled up and that vaccine is abundant, we are now seeing as much as 60% of our population having at least one shot and over almost 50% having two shots. And we're seeing a commensurate reduction in the amount of disease from COVID-19.
Now, Dr. Benjamin, given the recent review by health authorities in the US over Korea's response to the pandemic, what aspect of Korea's strategy do you believe has secured the most interest among health experts there in the US?
You know, Korea learned a lot from the H1N1 outbreak that you had, as well as the Middle Eastern Respiratory Syndrome, and even SARS-1. And you put that into practice. So you really did what is really sound public health practice. Lots of testing, good sound contact tracing, isolation and quarantining of individuals as appropriate. And that resulted in you getting your hands around the outbreak very early on and preventing it from spreading. And now, of course, you've got to move on to the vaccination part of your program. And I think you'll solve the problem.
Dr. Benjamin, in your personal view, can the strategy adopted by Korea perhaps be implemented elsewhere?
Well, there's no question about this. This is just basic public health practice, a good data system, doing the testing as we should, and then really preparing ourselves for getting vaccinations. And that is the key to this, utilizing this. This blueprint would work in every nation had every nation actually done it.
Dr. Benjamin, each country is dealing with the problem, of course, of vaccine hesitancy as governments seek to ramp up their vaccination drive. How are authorities in the U.S. tackling the problem of vaccine hesitancy?
I think we've done a lot about figuring out where the concerns were. We're not demonizing anyone. We're recognizing that everyone has concerns about any new medication. And we're getting a good message to those communities to get rid of a lot of the misinformation and tragically the disinformation where people are purposely giving people the wrong information. And then we're trying to get what we call trusted messengers. These are people that people trust. So their doctor, their nurse, religious leaders. We're empowering people in the community to encourage others to get vaccinated. And that works in the U.S.
Before you go, Dr. Benjamin, perhaps you could share your thoughts on Korea's ongoing vaccination campaign.
Well, I'm glad to see that, you're having the same challenges we did initially in terms of not having enough vaccine. But I'm really glad to see that it's ramping up. And I think knowing the kind of public health system that you have, you'll be very successful as soon as you get enough vaccine to make it as abundant as we have in the United States.
All right, Dr. Benjamin, again, thank you for your kind words and for making the time to join us live at this hour.
Thank you.
Right then, back here in the studio, Sebastian, as of Monday, all adults in France can register for COVID-19 vaccinations. What has been the public response to this move?
Well, indeed, in France, the vaccination momentum is picking up dramatically because it was starting very slow from February, but now the supplies are here. And so now, as of now, 40% of the population got a one shot of vaccination. Most of the oldest people have been vaccinated. And everyone now can apply, every adult can apply for this. And it's interesting because here also we see a change of tack among the population. First, there was a lot of reluctance, hesitancy, but now there's a drive because there's also a push around the people around you are getting vaccinated. It reassures people, so people are start to rush to it. And again, as I said before, people want to have their life back. And also in Europe, in France, summer holiday are a really important thing, and people are looking forward to that. And they want to enjoy that moment, and they know that if they can get vaccinated before that will make them more relaxed. So I think that's also pushing the drive. There's a sense of optimism at the moment in Europe because of the numbers that are dropping. Like in France now, we're the lowest number of cases compared to September. It's still dramatically high compared to South Korea because we're still talking about almost 10,000 a day. But the optimism among the people is there. Also, the weather helps. So there's a sense that it's worth moving on. So that's helping, I think, the vaccination drive. But again, there are still some people who are resisting, and I think in the coming months we're going to see that still these people are going to resist. And people know that the study showed you need to have 90% of the adult population to be vaccinated if you want the so-called herd immunity. So of course, in the coming months, this issue of vaccine hesitancy is going to come back to the fore, I think.
And staying with that, Sebastian, what are authorities in France seeking to do to address vaccine hesitancy?
Well, they are doing, like Dr. Benjamin said in the US, they are trying to fight against the conspiracy, trying to provide as much information. But I think they have taken a low approach because they realize also if you insist too much, it backfires. People mistrust. There's a lot of, these days, the political atmosphere is extremely charged. There's some election next year. So the government on this one cannot push too hard because it might lead to the opposite outcome. So it's a tricky path that the authority have to embark, and I think they are playing like they want to convince people on the long run, but they realize the best way to convince is that if people around you are getting vaccinated, that's the best argument to convince those who are reluctant.
Right, peer pressure.
Yeah.
Dr. Kwak, what are your thoughts on the implementation of incentives as of the start of this month, of course, here in the country for those who have received at least the first dose of the vaccine and at least 2 weeks have passed? What are your thoughts on these incentives? Do you see the incentives as rallying public support for inoculations?
I would think so. Just from my own personal case, I guess, I was really looking forward to the day that I was going to be able to take off my mask, maybe on the outside. And also the opportunity that the government is granting for people to start visiting their relatives at nursing homes and hospitals once they're vaccinated. Those are very great incentives to utilize. And I guess other types of incentives can also be implemented in a sense that more people need to be convinced at this stage to completely eliminate any hesitancy, and also to eliminate the mistrust that some of the people might have against the government's decisions to make certain plans. I think media has a huge role in doing so because there was, and this is my only personal view, that there was an exaggeration of side effects, exaggeration of certain procedures that people were having a hard time believing, and also people were becoming more scared to receive the vaccines. Now is not the greatest time to actually have that momentum. We need everybody, most everybody who are allowed to receive the vaccines to go get the vaccines. That's number one. Number two, we also, the government seems to be focusing very highly on getting elderlies to be vaccinated first. That's a very good tactic because that would enable us to minimize the mortality and the severe parts of the disease, but also the fact that, as Sebastian also mentioned, we still need everyone to get vaccinated in the end. So we cannot really discount the people in the younger generations and stopping them the opportunity to get vaccines. So I guess at this point, securing more vaccines for ourselves is also a very important part.
Right. And also, Sebastian, what is the list of incentives perhaps, or is there a list of incentives in France for those vaccinated?
Well, it comes back to the issue asked about tracing. Because one of the keys, like with this digital pass, could you access to some venue? These are the kind of incentives, like, can I go to a museum? Can I go to a theater? There has been a debate in the French Parliament about this. Are we going to use this to allow people to get in or not? You need to have a green certificate to get into some venue. So that's the kind of incentive, people will realize that if I'm vaccinated, I'm going to have a better life. I'm going to have access to more to culture, to entertainment, to my life back. That's the kind of incentive that I used. And of course, the vaccine is for free, these kind of things that we see in most countries. But this is more like a prospect about what kind of life you can enjoy quickly once you're vaccinated. That's in Europe the key message, I think.
Right, vaccinated and protected against the pandemic, of course. Dr. Kwak, what lies ahead for Korea in its hopes to pave a productive path out of the pandemic?
We're still lagging in the vaccination rate. Obviously, compared to other countries having 60-40% of the population already being vaccinated, we only have about 12 point something that's vaccinated even once. We need to go ahead far beyond that point, at least hopefully within the first half of the year. So we do need to get that plan currently implemented. So in order to do so, I still have to reiterate the fact that we still need to secure way more vaccines for ourselves. But hopefully in the Western countries, having seen the abundance of vaccines being left over, maybe we could have some of them come over to our country and also implement it to our own population. But also the fact that, as I said before, the convincing that everyone should still get vaccinated is the further most important part. With the limited resources that we have, if we can get still the 100% of that inoculated to everyone, we would still be on the track to receiving herd immunity in some time in the near future.
And staying with that, if authorities are able to inoculate 14 million people by the end of this month, with at least the first dose, does that put us on the right track then?
Absolutely. We would definitely see still a huge decrease in the mortality and severity rate. So in that sense, we would be much better off in the medical sector in the sense that we would have larger capacity to manage people who are to be admitted, let's say. But also, that will also put us in the right track going on to the second half of the year, because we have plans to also bring in a lot of the mRNA type vaccines and other viral vector type vaccines that are to come to the country.
Right. And Sebastian, as a foreign journalist looking at the situation unfold here in Korea, what more do you believe can the country do to ensure its standing perhaps in the global arena with regard to handling of the COVID-19 pandemic?
Well, I think as Dr. Korak said, of course, the key question is the supply of vaccine. This is the most urgent matter because that's the only way to really move forward and change the daily life, that's for sure. But then I think what's the big challenge ahead for Korea and for East Asian countries about how quickly do you reopen your country and the borders. That's a dilemma, you know, because you're gonna want to take part of the global economic recovery, but at the same time you want to protect your population. And if you are a bit late on the vaccine, the dilemma become even more acute. So I think that's going to be the big challenge for a country like here in the coming months. Is like, how do you balance that? Because you don't want to be sitting outside. And some countries in the region are taking a very cautious approach. Like you see Singapore coming back to a lockdown, Taiwan. So it's a very complicated situation. And you have to convince your population also that with the vaccine, means the COVID is going to circulate in the country. If you have vaccine, that doesn't mean the virus is not there anymore. It's just that it doesn't harm you as it used to be. So mentally, you need to tell your population, the next stage is not zero COVID. It's like COVID is here, but it's fine.
Right, a very good point. All right, Sebastian, thank you very much for your thoughts. And Dr. Kwok, as always, thank you very much for your insights.
Thank you.
Right, and let us not forget that Korea's COVID-19 strategy has been possible owing to the participation of its public. Do take care. Thank you for watching.